guys, this is Dr. Hub. Today we look at the primary deficiency disorders. So what does include here? So we look at the affected component of the immune system. So we have the humoral immunity. So under the humoral immunity, it includes the problems of the B cells. So the problem with the B cells and the antibody production. There's problem with the B cells and antibody production. So what are the disorders associated with the humoral immunity? There is a common variable immunodeficiency. Then comes a selective. There is selective immunoglobulin deficiency. And what does it include? It includes the IgA deficiency. Next, there is also transient hypogammaglobulinemia of infancy. There is a transient hypogammaglobulinemia. This is of the infancy. Next comes the X-linked gammaglobulinemia. X-linked gammaglobulinemia. Now, let's look at the cellular immunity. So we look at the cellular immunity. So they include the problems with the T cells. So problem with the T cells, what do they include? It includes a chronic mucocutaneous candidiasis. Next is also includes a DiGeorge syndrome. Then it also involves the X-linked lymphoproliferative syndrome. So cellular immunity, problems with the T cells, it includes a chronic mucocutaneous candidiasis, there's DiGeorge syndrome as well as the X-linked lymphoproliferative syndrome. Next we look at the combined humoral and the cellular immunity. So this includes the problems with the B and the T cells. So what are the conditions? The conditions that includes it: ataxia, telangiectasia. Next, there is also the presence of the immunoglobulinemia. There is a M syndrome. Next, there is the severe combined immunodeficiency, that's a SCID, and the Wiskott-Aldrich syndrome. Next, we look at the phagocytes. The phagocytes is nothing but the problems of the movement of killing. So what does it include? It includes a chronic granulomatous disease. Next is includes a Higashi syndrome. So that is rare. Then there is also the Tuftin deficiency, and the cyclic neutropenia. The cyclic neutropenia. Then comes the LAD. LAD is a leukocyte. The leukocyte adhesion defects. Then we will look at the complement proteins. We're going to look at the complement proteins. So complement proteins, it involves the deficiency of the complement proteins. And what does it involve? It involves the complement component, that is C1 inhibitor deficiency. Next is there is a hereditary angioedema. Then comes the terminal complement deficiency. There's terminal complement deficiency, there is a C5 to the C9. There is a recurrent Neisseria infections. There's recurrent Neisseria infections.